Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. This is a webinar about Lyme disease, and we create them each week with your questions. So it's up to you to figure out where we're going to go with our discussion tonight. Well, partly. As many of you know, I can get rather long-winded with some of my explanations because I'll use your question as a means of explaining a number of things. But so feel free to write your questions to me. Usually I'm not able to get through all the questions, but we'll get through as many as we can over the next hour and a half. We'll see if I hold up for the whole hour and a half tonight. And then for those of you that are new here, the way you write your questions to me is over here on the right-hand side of the screen, down at the bottom, is a chat box. And you can write your questions to me through that chat box. The only thing I ask is as you write your question, try to be brief. If they get too long, I can't post them. I can't go through them. They're too complicated to do in this kind of a format, okay? The second thing that I ask is do not hit your enter key until the whole question is written. Each time that you actually hit the enter key, it creates a separate question for me, which gets to be hard for me to follow on my side of the computer, okay? During the live version of the webinar tonight, which you are all participating in that are here live, I will post those questions so you can read them yourself on your screen. However, in the recorded version, they don't show up. So I wind up reading those questions as well, too. I am creating a recording of tonight's webinar as I do each week. And you can find that in numerous places. I do send out a notification in the morning when I have that recording edited and ready to go. That email will come out to you somewhere between 9 and 9:30 a.m. Pacific Standard Time, okay? But if you should happen to miss that email, you can find it a few places. Number one, you can find it on the homepage of my clinic website, which is at martyrossmd.com. You can find it at my Lyme information site at treatlyme.net on the webinars page. And finally, you can find a copy of it at Marty Ross MD Supplements on the homepage, about halfway down the screen on the homepage, and that is at treatlyme.com. Okay, so those are a few places. I also do post it up on my Facebook page, which is at facebook.com/treatlyme. Okay, so there's many places you can find copies of recording of the webinars. All right, okay. Many of you, just so a number of you are participating, know that I have my whole Lyme disease information site, and usually I'm pretty prolific about putting out new information. I just urge everyone to give me a moment to get going on that part again. As many of you know, I moved back to Seattle from Austin, Texas at the end of September and have been spending my time trying to get my clinic reopened, which is reopened. But it's taken a lot of time. And so I haven't had quite the amount of time to create new information articles for you all and update the old ones. However, I'm now at a point that I should start getting going on that again. So probably in the next week, you'll be getting emails notifying you of when I have new information available. Some of that new information is made from video clips that I do from these webinars too. So your questions help me create new information that I can put up online as well too. All right. So with that all being said, let's go ahead and get started here. Let's see. First question. This is from Nancy. Hi, Nancy. Let's see. Are day sweats indicative of Bartonella and night sweats indicative of Babesia? What is the connection between high sulfur contents of food, such as garlic, and mitochondrial function? Can Bartonella hide in your system without being symptomatic and symptoms be triggered years later? Is there a connection between mycoplasma and pelvic issues, such as proctalgia? Okay, so I'll try to go through these quickly one by one. All right. So first of all, commonly, one of the symptoms that we see with the parasite, the blood parasite called Babesia that you can also get from a tick bite, is night sweats, okay? Occasionally, though, when people have excessive night sweats, they also have them in the daytime. But typically, we tend to think of Babesia as being more of a night sweat producer. And usually those night sweats are pretty heavy sweats. They're kind of like soaking the bed sweats, okay? Bartonella, on the other hand, tends to give you more of increased day sweating versus the night sweats that we see with Babesia. So that's true, the way you described that, okay? I do not know what a connection is between high sulfur foods and mitochondria. I'm sorry, I just don't know one off the top of my head. Can Bartonella hide in your symptom? Yes. All of us have the ability, our immune systems have the ability to keep germs under control. And so not everyone that gets a Bartonella infection may go on and get full Bartonella disease, okay? It's possible that your immune system may be able to keep that germ under control or maybe even get rid of it on its own without us ever using antibiotics. And it is possible, same thing with Lyme. That is also possible with Lyme too. And so for whatever reason, at times the immune system loses that battle. And so it's possible people get these infections years before they ever get symptomatic. And it's only when the immune system starts losing its ability to keep these germs under control do people start developing symptoms. One of the biggest reasons your immune system can lose control of these infections is stress. High stress is one of the biggest suppressors of the immune system, and therefore big stress events sometimes can be the thing that breaks the camel's back that triggers people to go on and have Lyme, okay? Or their Bartonella to get active, okay? Let's see, the last part, is there a connection between mycoplasma and pelvic issues or practalgia? I am not aware of one, okay? All right, thank you for that question, or those questions, I should say, Nancy. Good luck to you. Hello, Karen. Let's see. Hello, Dr. Ross. Some days I can barely force myself to take all my pills. My main issue is Bartonella. I've been seeing a psychiatrist every week for 10 years. Below is what I take daily. Could I cut back on the number of pills I am taking on some days? Which ones? Bactrim, minocycline, ashwagandha, cytoquel, quercetin, Capri Plus, liposomal curcumin, alpha-lipoic acid, ATP 360, Aclonia cava, HMF forte, core biotic sensitive, liposomal glutathione, omega-3, magnesium malate, nystatin, cholestyramine, methylcare, naltrexone, efexoranitidine, Claritin. That's a lot of pills. I can understand why you might be asking. The problem is I don't know enough about your healthcare, and I'm not your physician. So for me to tell you whether you should stop something ultimately is something you should be discussing with your provider who knows those details, okay? I will make a couple observations though. So the cytoquel that you're taking and the Aclonia cava and the quercetin all have one thing in common, and that is that they can help limit Herxheimer reactions and lower inflammation chemicals that are made when somebody has Lyme disease. So there's a group of inflammation chemicals called cytokines. This will be my brief cytokine talk real quick. So cytokines, everyone, are made by white blood cells when they see Lyme, when they see yeast in your intestines, when they see mold toxins in you. Your immune system makes cytokines turn white blood cells on to get rid of those conditions more easily. In Lyme, sometimes in mold toxicity illness, sometimes in yeast overgrowth in the intestines, the immune system has a hard time getting rid of these things, and so it tries harder and harder, and eventually makes too many cytokines. Too many cytokines actually give you what we call Lyme disease symptoms. Too many cytokines give you what we call mold toxicity symptoms, and too many cytokines give you the majority of what we call yeast overgrowth symptoms, okay? So these things can all look pretty similar at times. I don't know that you need to necessarily be on all three. And if I were to remove one, if you were my patient, I would suggest removing one. I'd probably say get rid of the Aclonia cava. In terms of cytoquel versus quercetin, I would tend to stay, the quercetin, in addition to lowering cytokines, has the ability to control something called mast cell activation, which is a triggering of allergic cells in your body. If your provider is not using quercetin for mast cell activation, you could consider letting that one go as well too, okay? Because the cytoquel will control your cytokines, all right? Then, if I look at something else that's being duplicated, if I look at your alpha-lipoic acid and I look at the glutathione, they essentially are doing the same thing. The glutathione is a very powerful antioxidant that's made in every one of our cells, and it's used by our cells to repair damage, okay? It's also the key detox agent that is used by the liver to clear toxins out, and it can be used. It can protect the liver from injury as well too. And then finally, glutathione is a really strong antioxidant that can also help lower cytokines through a different way than what the quercetin and the cytoquel do. Okay. Now, alpha-lipoic acid is an antioxidant that is turned into glutathione. All right. So you don't necessarily need to be taking two ways of increasing your glutathione. You might be able to let that one go. I generally don't find much benefit in doing the omega-3s in this disorder. And then finally, your nystatin and Capri Plus are actually taking care of the same thing. They're both removing yeast. Now, if you're having a hard time getting rid of yeast, I don't think I necessarily would remove one. But if your yeast is under fairly good control, you may not need both, okay? Now, those are my observations, all right? I don't know enough of your history to say, is it a good thing to definitely stop this one or that one? Again, these are things you should talk with your physician about, okay? All right, very good. Good luck to you, Karen. Thank you for that question. All right. Hello, Aaron. Let's see, Dr. Ross. I'm going to do my best to keep this short. Well, I know you tried. It's still long, but we'll take it. Okay. So here we go. I was diagnosed with tick-borne relapsing fever and Bartonella based on IGeneX and probable Lyme in October. After a 4-year battle with Western medicine, I see a Lyme literate medical doctor in the San Francisco Bay Area. We have tried 3 different antibiotic combinations, and each time my body crashed very hard. I became suicidal, and the Herxheimer was terrifying. My Lyme literate medical doctor is feeling like, for whatever reason, I am too sensitive right now for this path. We are going to try an herbal route very slowly after building up my immune system and calming inflammation. I have been reading volumes about Buhner herbal protocols. My main symptoms are severe derealization, disconnection, and dizziness. I also have anxiety, fatigue, and weakness. I am unable to work, drive, or really function at all. The feeling of being in a dream with numb pain is the absolute worst. I have only found one online forum where Buhner addresses similar symptoms, and he suggests antibiotics for a short time, then herbals. I'm overwhelmed with the amount of herbal remedies it takes to make a protocol. Where would you start given this symptom and my sensitivity? What herbal protocol would you suggest? And how would you introduce them? Do you think herbs will be sufficient for severe brain symptoms? Thank you. All right. So comment for you. I'll help you answer that. So yes, the thing about Buhner herbs, Buhner does a nice job describing herbs, but he throws a lot of herbs at a problem, okay? And so his protocols can be very difficult to do. When it comes to Buhner, there's 2 things that I really like that I've learned from him about managing Bartonella. Now, and I don't usually do his whole protocol. I usually do his 2 main Bartonella germ killers. And those 2 Bartonella germ killers are the Sitta acuta that he talks about, and also another herb called Hutania, all right? Those herbs together, I find effective against treating Bartonella about 70 to 75% of the time. They compare with prescription antibiotic combinations for Bartonella, that prescription antibiotics, which usually use something called rifampin or Bactrim, and there's other ones, those combinations will work about 80 to 85% of the time. So the herbs for Bartonella are not quite as useful, okay? Now, when I look at your symptoms, your main ones are Bartonella symptoms, okay? So Bartonella, which is one of the Lyme co-infections, is known for giving a lot of psychologic and neurologic problems, all right? So that derealization you're having and the disconnection and the dizziness and the anxiety are more than likely more Bartonella than they are necessarily Lyme symptoms. Lyme and Bartonella both together could give you that fatigue and weakness that you're having, okay? But I would say you've got the main thing that's driving your symptoms, I think, from what you've described here is more of a Bartonella rather than a Lyme problem. I'm not saying you don't have Lyme, but I'm saying the more significant issue looks like to me it's probably Bartonella. All right, so what if I were treating somebody in your situation where they had a lot of sensitivities to drugs? I have at times started my Bartonella treatments by going herbal first, and if we can, then I eventually will switch over to prescription antibiotics. I have seen Bartonella herbs, the Sitta acuta and the Hutania, do a good job of helping with this kind of a symptom complex that you describe here. Okay, again, I give them a 70 to 75% chance they'll work. Okay, what I would suggest doing, if you were my patient, what I would do is I would probably start you on Sitta acuta and Hutania at 1 drop of each twice a day. And in 2 days, if you're tolerating it okay, I would increase to 2 drops 2 times a day. And in that fashion, I would gradually try to work up to 30 drops 2 times a day. That's if you can, all right? Sometimes people that are very sensitive, we might only be able to get them on 1 drop twice a day. Sometimes we might even be able to get them just on 2 drops twice a day. When somebody is really sensitive, it often means that they have some detox problems, which makes it hard for them to get to clean out the things that we give them. Okay, so what ultimately you want an adequate level of both of these medicines in your blood so that they'll kill Bartonella. What determines the level in your blood is how much do you take and how quickly your body can detox them or clean them out. All right. And I often find that people are very medicine sensitive. It probably means they're having a hard time detoxing those chemicals out. And because they have a hard time detoxing out, we don't have to give them as much. So although I generally have a goal with these 2 herbs of working people up to 30 drops twice a day of each, there are times I have actually gotten people well by doing 1 drop twice a day. I've got a patient that I help manage from up in Canada that it took 1 drop twice a day and we were able to get her Bartonella under control. Okay, it may take you longer to get there, but it is possible to do that. All right. Once you are on the Sida acuta and the Hutania, and you're stable at whatever dose you finally wind up at. I mean, if you decide it's only 5 drops twice a day you can handle, great. That's what you do, okay? Then once you're stable on those, then I might also add in 2 herbs to treat Lyme. One of these is one that Buhner does not recognize, but I have found very effective. So I would use cat's claw, which Buhner does talk about, and I would combine that with another herb called otoba bark. And those 2 herbs come to us out of the Cowden protocol. And there's been some Petri dish experiments looking at those 2 herbs, and those Petri dish experiments show they're great at killing Lyme, and they're great at removing the biofilm slime layer that Lyme develops to cover itself, to hide from the immune system and to hide from the antibiotics, okay? And there's Petri dish experiments that show they're very effective. So again, once you're stable on whatever dose you wind up on the Hutania and the Sida acuta, then I would consider adding otoba and cat's claw. And the way that I would wind up using those, I'd start at 1 drop twice a day. And every other day, I would try to increase the dose up to a level you can tolerate that doesn't tip you over. Okay? All right. Now, those are just your germ killers. Okay? You should probably be on some probiotics. And I would need to ask you, I would also have you on some things to lower cytokines. Remember, I mentioned cytokines earlier tonight. And for that, I like using liposomal curcumin, which is a product made by Thorne called Meriva 500. You want to be on that to lower inflammation in your body, okay? And you would take a 500 milligram pill 3 times a day. Given this significant neurologic dysfunction too, I would probably also put you on some glutathione. And I would do a liposomal variety of glutathione. Liposomal means it's microscopically wrapped in fat to increase absorption. The glutathione can help repair some of the nerve injury, but also is used by the liver to improve detoxification. Okay. And so I like using liposomal glutathione. I would start at 1 teaspoon of a product called Tri-Fortify by Researched Nutritionals. They've got good studies that show this stuff actually increases levels of glutathione in you. So it does seem to work that way. Okay. So those are some minimal things I would do. There may be more I would do, but I would have to ask you a lot of questions to figure it out. So I've kind of given you the essentials, okay? The essentials are lower inflammation with Meriva 500 curcumin 3 times a day. Hello, everyone. It looks like I lost internet connection there for a few minutes, and that means that I have lost all of the questions you wrote. I'm sorry about that. For those, if people are still here, it looks like I may have a number of people that are still here. Feel free to try to write questions to me again, and I will try to get through those. So I apologize for that. I just literally lost my whole internet connection, but thankfully we're back again. So we'll keep trying to do this as long as people are here, okay? For that last question, I just want to do a wrap up. I want to show you 2 things to take a look at, okay? These were the questions about Bartonella and Lyme herbal treatments. So I'm going to do a quick screen share here. All right. Let's see here. All right. So this is back at my Lyme disease information site. Those two herbs that I mentioned about Lyme are called Otoba and cat's claw. And I have a whole article about them and why they work, okay, and how to use them. That's this article here, okay. In terms of an article that I have about how do you treat Bartonella with herbs, take a look at my section up here called Infection Treatment Plans, and then scroll all the way down to you see this part called Kills Bartonella, a brief guide, all right? And in here, as a third option for treating Bartonella, I list Sida acuta and Hootenea, okay, all right? And then finally, for my recommendations about glutathione and also about cytokine control with that curcumin, take a look at my Ross Lyme support protocol, which is right here, okay? And these are the essential steps you take to get over Lyme and Bartonella. Number one, do things to get sleep if you're not. Number two, I like people being on a paleo diet, but my third part is cytokine control, and that's where I was talking about the curcumin, okay? And then in terms of detox, I mentioned being on glutathione. Take a look at part 7 here. I talk about that liposomal glutathione right there, okay? All right. In terms of where you can get some of these medicines that I recommend, take a look at my supplement store, Marty Ross MD supplements. I carry everything that I mentioned here, okay? All right. So let me go back here. All right, there we are. So it looks like I've got a number of people rewrote their questions. I'm sorry about that. I can't control what happens here from the internet provider standpoint, but I'm glad we're still going here. All right. Let's see here. Get out of here. Hello, Natasha. Hi, Doc. My mold expert gave me a protocol to kill Bartonella using Banderol and Hootenea, 5 drops twice a day of each at most, if I can even handle that dose because I'm sensitive. Very sensitive, but your book says add Sida acuta. I cannot add it in at the dose you suggest. It would have to be 1 drop at a time till I cannot take any more. I go to my GP tomorrow to discuss this, but Dr. Nason says he leaves it up to the GP to decide how to treat it. I'm not sure I even have it, but I want to make sure that I am not missing everything else to add and did I read it correctly that you find it works 70% as opposed to antibiotics, which is higher. I do not feel I can handle the antibiotics. Thank you, Doc. Always appreciated, Natasha. Okay, so Natasha, good question. So everyone, Dr. Neil Nathan is an expert on managing mold toxin illness. And he also finds that when people are having a hard time with mold toxin illness, that they commonly will have Bartonella. So he automatically thinks, especially in patients that are super sensitive, very sensitive, that in addition to the possibility of mold toxin illness, they all most likely have active Bartonella. That's his assumption, okay? So it sounds to me like he's probably thinking, because of that, that's where he comes from, he's wondering about Bartonella being active in you. I would not think of the Banderol as being something effective for Bartonella. I'm not sure why he would have recommended that. Banderol is usually something more for Lyme. I haven't seen any information to suggest that it is an effective Bartonella killer. Now, he may have some different experience working with it than I do that way, but I've never used it for Bartonella. My 2 herbs that I was just mentioning in the previous question that I like using for Bartonella are Sida acuta and Hootenea. And I would not dose it how you saw me write about. For the sensitive patient, I would start at 1 drop twice a day of the Sida acuta, just like I would do 1 drop twice a day of the Hootenea. And then Natasha, if you were listening in on the last question that I answered, what I had said on both of those is, you start them and you go to a dose you can handle. All right. So if you have a lot of sensitivity detox issues, you don't need to put as much of the medicine in because you're not cleaning it out that fast. Okay. All right. Good luck to you, Natasha. Hello, Gail. Thank you for taking my question. I have Lyme and Bartonella. I think Bartonella may be the theme of the night here, it looks like. Let's see. I have very bad right-sided lumbar pain, and the MD says it's probably facet joint and maybe SI joint. He wants to do a steroid injection. I know oral steroids are a no-no. What about injections when you have Lyme and Bart? He also spoke of ablation to the nerves, but my nerves are very fragile and easily bothered, and this scares me. I am thinking of trying PRP, platelet-rich plasma, everyone, but worry since Bartonella lives in the red blood cells, maybe they would just be injecting Bartonella into the joint. Is that possible? I have tried massage, chiropractic, PT, and always react badly to acupuncture. My body is too sensitive nerve-wise, and it always causes new pain. Thank you for giving me your opinion and my questions and any additional thoughts you might have. Okay. So, yes, I am concerned when somebody does steroid injections because we think steroids suppress the immune system, which allows Lyme and Bartonella to get more active. Okay. That's the problem when we look at doing steroid injections, basically. Okay. In terms of, in this situation, though, if you do not have, well, another point then. So platelet-rich plasma is not the red blood cells. So Bartonella lives in red blood cells. Platelets are a different type of cell. Bartonella does not live in a platelet. And when they do platelet-rich plasma, they basically are removing your platelets and some of the blood liquid, not the red blood cells, and they're injecting that back in the area. The idea with platelet-rich plasma is it contains growth factors, they think, that helps regrow cartilage in joints where it has been damaged. Okay, that's how they think it works. It's a newer type treatment. I think you would have less of a risk in terms of potential activation of Bartonella and Lyme by doing the PRP injections over doing steroid injections, okay? I definitely would talk this over with your Lyme literate medical doctor and get their opinion, okay? But that would be my opinion on that, all right? All right. Good luck to you. Hello, let's see, to admin. Earlier you told Aaron to start on 1 drop of Sida acuta and Hutania and eventually 1 drop of Otoba bark and cat's claw. Oh my God. I started all 4 and started with a dropper of each twice a day. Plus I'm taking Bactrim and minocycline. Am I taking too much? Am I okay taking this much? I want to get rid of Bartonella so badly. All right. So with Aaron, the concern I had was being too aggressive because we already know she's sensitive. Okay, you've started at a hefty dose. Now the question is, are you tolerating it? Okay, so if you started at those doses and it hasn't clobbered you with a Herxheimer reaction, then you're okay. The reason that I build up those doses slowly is I don't want to trigger a significant bad Herxheimer reaction. Okay. Aaron is a different person than you, all right? You might be able to handle doses like that, but generally that's a lot more aggressive than I would start. But the reason in my writings that I recommend starting slower is I don't want to clobber people, especially people I don't get a chance to evaluate to figure out if they might be able to handle those kind of doses. So if you are tolerating that, if it's not giving you significant Herx reactions, you're okay. I don't think there'd be a problem continuing to do that, okay? So everyone, what a Herx reaction is, for those of you that don't know, that may be new to this, whenever we start killing Lyme germs, and sometimes Bartonella, although I don't find it as often with Bartonella, we can trigger something called a Herxheimer reaction. And in this, what happens is in this situation is our immune systems respond to the dead bug parts by making more of those inflammation chemicals I was discussing earlier called cytokines, okay? So everything looks worse because you start making more cytokines, basically. All right? All right. Thanks for that question. Hello, Marie E. Let's see, I've been trying to treat Lyme and Bartonella for quite some time now with Herbal, since here in Quebec, Canada, Lyme is not recognized and treatment is hard to get. Throughout all those years of treatments, I have been feeling my digestive tract completely stuck or blocked, bowels not moving, and thus having trouble detoxing. I've had many tests, tried all kinds of supplements until recently I started feeling something biting me from inside and the upper part of the intestines. Somehow I know someone I know scanned me with biofeedback machine, and I had the confirmation of what I thought. I had a tinea infection, which is tapeworm. 2.5 years ago, I thought I had a tinea infection, and the parasite stool test did not show any sign of it. So my doctor didn't give me any medication. Now my doctor said she read tinea doesn't always appear on testing, but she still will not give me medication without proof. And my naturopath says with herbals it can take up to a year and very strict diet. I read your article on parasites. What would you suggest in circumstances if I can't have access to medication? And if I can have medications, would you use praziquantel, Alinea, nicolosamide, or something else? My doctor had no idea what to use. Thank you very much. So without the most universal anti-parasitic medicine is the Alinea, meaning it has the ability to take care of a wide variety of parasites. And without having stool tests that prove what is in there, that's the one I use if I am considering that somebody has intestinal parasites, okay? I don't know how accurate this person scanning you was at finding true parasites there, but if it is true you have parasites, it is the Alinea that I find to be the most effective one, and I mentioned that in my How to Treat Parasites article. Okay? All right. Very good. Good luck to you. Hello, Alan. Dr. Ross, thank you for having these webinars. They're amazingly helpful and appreciated. You're welcome. I'm glad you're getting some benefit out of it. My current situation, about a year ago, I had the Igenix borreliosis IAFA GMA with an equivocal result of 40. My immunoblood IgM showed 1 plus on band 31 and indeterminate on band 23. The IgG had 1 plus for bands 18 and 41 with an indeterminate for band 31. The Babesia decani IFA IgG was negative. Would this lead you to believe I have Lyme and that it has not been treated effectively, considering I have only had 6 weeks of doxy? I also have seen a Lyme literate LMD, Lyme literate medical doctor believes I have Bartonella due to muscle issues, joint issues, weight loss issues, and some rare pain on the soles of my feet, although I have not had the Galaxy Diagnostics lab run a triple blood draw Bartonella test to confirm. Can Bartonella be cured? So I guess you got 2 questions here. The first one is, I guess, is this Lyme? And the second one is, can Bartonella be cured? All right. So your Lyme testing using that immunoblot is what I would call indeterminate. It's not positive or negative, unfortunately. And so I would need, when we make a diagnosis of Lyme, there's actually 4 things that we consider, okay, of which testing is only one thing. Testing can be wrong sometimes. Sometimes you get a negative test and you can still have the germ, or sometimes you get a positive test and you don't have the infection at all, okay? Because you can have false positives, false negatives. So when we make a Lyme diagnosis, there's 4 things we look at. One is, what's the risk of getting it? Are you a person that might have had a high chance of running into a tick, or did you have a known tick bite? If you didn't have a known tick bite, realize 50% of the time that people have Lyme, they don't remember tick bites, all right? So then we're considering, well, how else could they have gotten it? Could it be sexually transmitted? Yeah, if you've had partners that have had it, there's the possibility, okay? And I write about that on my Lyme site. Not a high possibility, but there is a possibility. Have you been in areas where there happens to be a lot of baby ticks and you got bit by one and you just didn't realize it? Those are called nymphs. They're the size of a poppy seed and you may not know it. Okay, so for instance, are you a person that spends a lot of time at the shore in Cape Cod where there's a lot of Lyme? Have you spent a lot of time in the New England states? Have you spent a lot of time in the upper Midwest? Have you been into Northern California? These are areas that have a lot of Lyme, okay? The other we consider, do you do outdoor activities that might put you near ticks? So for instance, deer hunters, there's high probability they could have been bit and not even know it, okay? So we look at what's your risk. Number 2, we look at, do you have enough symptoms that look like Lyme? And if you have enough symptoms, we consider you could have Lyme. Okay. Now, Horowitz, who's one of my colleagues in New York City, or I'm sorry, New York State, I should say, has developed a Lyme disease questionnaire. And he's been trying to figure out, of all the symptoms that people have with Lyme, what are the ones that most likely indicate they have Lyme? And what he's been able to show through some studies is that people that have a symptom of wandering pain, where it hurts one place one day, another place another day, or wandering neuropathy, meaning numbness or burning type pains, if you've got wandering qualities to that, that wandering nature is very specific for Lyme and may even be as accurate as getting a Lyme test done. Okay, all right. Beyond the symptoms, then we look at, are there any physical exam findings? And then finally, the fourth thing we consider is, do you have a supportive test? Now, notice the word I said, supportive. A test does not diagnose an illness. A test is just another clue that we use, okay? So if you had a lot of risk factors of getting Lyme, and you had a lot of symptoms suggesting Lyme, and again, I can't tell from your question here, with that, what immunoblot that you have, then I would say you probably have Lyme, okay? All right. Second part of this is, can Bartonella be cured? I think so. I know there's a number of my colleagues that don't. All right. I tend to have pretty good success in my treatments getting rid of Bartonella. But I'm treating it usually using at least 2 antibiotics at the same time. And I'm tending to do a lot of things that help support the immune system, like having people get sleep, like lowering cytokines, like getting yeast out of the intestines. If you look at my whole Ross Lyme support protocol, ultimately, all those things I recommend, including even detox, ultimately result in your immune system working better so it can jump in and help against Bartonella. There are some people I do have a hard time getting over Bartonella, and for that, I usually will wind up using triple antibiotics on them. And more recently, I've started adding to my treatments one of two things, either oregano oil or something called Methylene Blue. Both oregano oil and Methylene Blue have been shown on Petri dish experiments by a Dr. Ying Zhang, who's a medical doctor out in Hopkins, that's been trying to find ways to treat what is known as persister Lyme and persister Bartonella. And he's been able to show that Methylene Blue, and on Petri dishes, that is, we don't know if it works that way in humans, but on Petri dishes, that Methylene Blue and that oregano oil have the ability to treat these persisters, okay? So let me talk about that real quickly. So it appears that Bartonella has a growing form and can develop what's called a stationary or persister form. The stationary or persister form is something that develops after the germ's been exposed to antibiotics, and essentially some of the germs go into hibernation. They just sit there. If you could wake them up, they'll start responding to the antibiotics again. So there's been a lot of work looking at, and the same situation happens in Lyme too, okay? So there's a lot of work now in the various labs across the country over the last 4 years starting to look at ways to treat these persisters. Ying Zhang, medical doctor, used to have a lab. His lab used to focus exclusively on tuberculosis. That's how he comes to this, is out of the world tuberculosis that also has persisters, okay? But he's decided to help out in the world of Lyme, and he's been experimenting with ways to figure out how do you treat persister Lyme and persister Bartonella. And what he's discovered is Methylene Blue, at least on Petri dishes, can do that. And he's also discovered that oregano oil is one of those things that can help too. If I do oregano oil with a patient, I want to do a liposomal variety of it so that it's microscopically wrapped in fat to be absorbed. Usually we do 1 capsule twice a day. If I'm using Methylene Blue to help with those persister forms and somebody that's not getting better, I would do it as a compounded, also in a liposomal form, and I would do it as 50 milligrams 2 times a day. Okay? All right. So those are some thoughts, and I've been starting on people I'm having a hard time getting over Bartonella. I've been starting to add either one of those to their triple antibiotic regimen that I would use for Bartonella. All right. I'm going to soon be adding some information to my Bartonella article about that. I haven't added it yet, but it needs to be updated to include a section about what to do if you're not getting better from Bartonella. And that section will have in it that I would suggest 3 antibiotics. And I would also suggest either the Methylene Blue or using liposomal oregano oil. Okay? All right. Good luck to you, Alan. Thanks for that question. Hello, Stephanie. Hi, Dr. Ross. I was recently diagnosed with Lyme, still waiting on co-infection results, currently taking doxy and plaquenil along with spironol, biotox, alim, and biocidin. Just received something results. Can you tell me, blood work results? Can you tell me, does the test absolute CD8, CD57 lymphs test reflect Lyme? The reference number is 60 to 360. My result is 51. Also, test complement C4a came back extremely high. Reference range 0 to 650. My result is 2,849. Would Lyme cause that result? My C3a is normal. Thank you for all your help, Stephanie. Okay, so these tests called C4a and C3a are part of a way the immune system fights infection. That it's called the complement system. I'm not going to go into how it works exactly, okay, but these are two types of complements. That C4a can be elevated when you have Lyme. The other thing that causes it to be elevated is mold toxin illness. So when it comes back elevated, it does not necessarily mean it's coming from Lyme. Sometimes you've got to make sure that you don't have mold toxin illness possibly triggering that, okay? The C3a is another complement that tends to be elevated in acute Lyme, but not in chronic Lyme, all right? And the C3a has nothing to do with mold toxin illness from what we know. The CD57 is a type of white blood cell that can be suppressed when people have chronic Lyme. Probably is suppressed about 80% of the time. I've had people with chronic Lyme that don't have suppression of it, and my sense is that happens 20% of the time. Okay, we consider it to be low when it is under 100. Okay, 150 is what I consider to be low. And it is something that may get back to normal as you get treated, and it may not. Even if it does not, that doesn't indicate anything about your long-term benefit from treatment, though. Okay? All right. So I hope that answers your questions there. Let's see. Yep, I think that was the questions. All right. Good luck to you. Thank you for that question. Hello, Lisa. Let's see. My LMD has pulled me off all meds to get a new baseline. After doing this, my symptoms return rather quickly, so I suspect it's BART. Even so, he wants me to retest via IGeneX for Lyme, Babesia, and BART. He retests frequently. Do you think this is necessary, especially since BART was positive less than a year ago via IGeneX? Ever hear of T labs and doing a blood smear? Is IGeneX okay to retest for BART? All right, so I strongly disagree with my colleagues that have gotten in this pattern of retesting. It's not useful and it's not accurate. And let me explain why I'm saying that, okay? So the majority of testing that we do for Lyme, the Western blot and this newer immunoblot, are looking to see, are you making antibodies? Okay, all right, I'm going to say more about that in a second. The testing that we do for Bartonella, the majority of it is an antibody test. Now there is, and that can either be the Bartonella Western blot that IGeneX is now doing, or the Bartonella IFA. It's an antibody test, okay? However, they do have something called a FISH test, which is a microscope test for Bartonella. But if Bartonella is in you, you have to have a lot of it to be seen on that FISH test, okay? All right, now, some of my colleagues are going back and they're retesting your antibody levels, either doing the Western blot again and seeing how reactive it is, or doing your IFA testing and seeing how reactive it is for Bartonella, or doing the Western blot again and trying to see how reactive it is, all right? And they have some sense that if you're making more antibodies, higher amounts, it's more reactive, that somehow indicates the germ is more active. And that is just ridiculous. And here's why it's ridiculous. When we measure antibodies, we're trying to see how active is the immune system. It might be that as you get your germs under control, the immune system can become more reactive and respond more strongly to the germs and make more antibodies, okay? Likewise, sometimes when the germs are more active, there is so much immune suppression that you're not going to make adequate antibody levels, okay? Finally, the type of antibodies that we usually are able to see after somebody's been sick for a while is IgG antibodies. And IgG antibodies are the memory of the immune system. They are always going to be there, okay, because they're the memory of the immune system. So testing and seeing them does not tell us whether your germ has gotten more active. For some reason, my colleagues are trying to figure out, is there some proof that these germs are there? We don't have proof that these germs are there and still active, nor is there actually a test we can do that says we are done treating. That kind of a test does not exist, okay? And so anyhow, I just want to, I think it's foolish that that a lot of these doctors are doing that. I just don't understand the rationale or what their thinking is on that. Anyhow, in terms of the T labs, I'm not familiar with that lab, so I can't say anything about it. Okay, all right. Good luck to you. Oh. Yeah, and one thing at least I would say too, I agree. When your provider is thinking it might be Bartonella, yeah, the reason is Bartonella. If you're not done with treatment and you stop antibiotics, it replicates very quickly. So every 24 hours, Bartonella can replicate, and because it replicates every 24 hours, makes new babies every 24 hours, and the period that you are off of antibiotics, you can get germ growth back pretty quickly, which will give you return of symptoms usually within a week to 3 weeks is what I see. Okay. Lyme, on the other hand, is an extremely slow growing germ. And so we tend not to get symptom return too quickly with that. And in fact, often it can take up to 6 weeks to a month when Lyme is still active and you stop antibiotics before you start getting symptomatic from it. Okay. All right. Good luck to you, Lisa. Hello, Lisa. Let's see. I tested positive for babesiosis, had an infection, MCAS, and POTS. My symptoms began 2 weeks after a tick bite with a rash at 2 bite locations. I am starting dapsone. I react to most antibiotics. My reactions involve slurred speech, facial twitching, elevated heart rate and blood pressure, and muscle weakness. I have also joint and muscle pain and have started swelling on the side of my face. What should I pursue for treatment? Next for treatment. Wow. Lisa, I don't know. I can't figure out how to design a whole treatment for you with just this brief of a description. Okay. It would be foolish for me to do that. I would need to know a lot more, like to ask you a lot of questions to figure out what's a good idea for you. Okay. If you do want my input that way, I'd be glad to do that for you, but I would need to actually have what I call a consult visit with you that we can do online using a telemedicine video visit platform that I have. I'll show you where you can look at it and see if that's something you want to do. I'm going to do a quick screen share on that. Okay. All right. So if you go to my practice website, this is my clinic website called Marty Ross MD Healing Arts, and that's at martyrossmd.com right up there. Okay. If you click on my appointments page, I describe that there are 2 types of visits I do. I do something called a full medical service and something called a limited consult service. Okay. Through this page, if you click on that book now button, you can book. And to reach my telemedicine portal, you click on that Go Now. Okay. But you need to read to see if this limited consult service is right for you. All right. Because I don't get to examine you. There are a couple limitations about this visit. One is I can't prescribe, and 2, I can't order tests. However, I can still make recommendations. And if those recommendations require antibiotics, I provide you a doctor's note of the visit that you can show your existing provider. Read through here and see if this is right for you, and pay attention to these forms down here that need to be filled out and sent to me at least 2 business days before the visit. Okay? All right. Go back up there. All right. Good luck to you, Lisa. Hello, Steve. Hi, Dr. Ross. What is your opinion on Teasel root for Lyme? Have you ever recommended it? So I do. So Teasel root is an herb that can work against Lyme. My favorite two herbs are to do the Otoba and cat's claw that I mentioned earlier. However, if I've got somebody that cannot tolerate one of those two, often it is Teasel root that I will substitute in for it. Okay. At my one product that is a Teasel root product is something called Spironol. There was a person that mentioned they were on that earlier tonight. The one I use is from Wildcraft Herbs. You can find that at my supplement store, and it is just called Teasel root. Okay. The way that I tend to dose it is the same that I do the Otoba and the cat's claw, which is I work a person slowly up to 30 drops twice a day. All right. Thanks for the question, Steve. Good luck to you. Hello, B. Hold on here just a minute. Let's see. I read somewhere that heat increases the efficacy of antibiotics and that a minimum of 15 minutes is recommended. Is that accurate? I'm doing YMCA sauna 3 times per evening after 30 minutes of exercise. Does raising the body temp work? Okay. So anything that heats you up, including exercise that you're already doing 30 minutes of, is going to improve blood flow deep into your tissues. And here's how that happens. Whenever we heat up, our body eventually gets hot and it tries to get rid of some of that extra heat, okay? And what it does, in addition to sweating, is it also tries to send more blood flow to your skin so that some of that heat will evaporate off of your skin. All right. And so when it sends more blood flow to the skin, it literally dilates open all of your blood vessels. It makes them, even the small blood vessels, makes them dilate open, get bigger. And it isn't just the blood vessels that go to your skin, it's the blood vessels throughout the body, including those that get deep into your tissues, deep into your muscles. So anything that leads to better dilation of those blood vessels may result in better flow of your antibiotics deep into your tissues. Okay, that's the rationale behind it. So you could do that with exercise. You could do it with a sauna. You could do it with either one. And in theory, you may get better movement of antibiotics into the areas where the germs are. Okay, all right. It doesn't mean everyone has to do it, but it may give you better benefit, basically. Okay, all right. Thanks for that question, B. Hello, Geraldine. Hello, Dr. Ross. Thank you for the informative and encouraging appointment at your clinic on Monday. You're welcome. Good to have seen you. Would like to understand a bit more about Herxheimer reactions. Mine start with reflux, then back pain, chest, jaw, and neck pain. Would moving the muscles and exercise assist and moving toxins out? Good question. Yeah, I honestly don't know. One thing you could try is try exercise, but I would do it in a limited way. I wouldn't over-exercise, because if you over-exercise, you're going to pay the price the next day sometimes, okay? But you could try some movement and see, do you turn around a little bit more quickly from it? But I honestly don't know. I haven't been asked that question, nor have I recommended to somebody before. I'm always learning something new in Lyme after all these years of managing it. So, but I wouldn't have any issue with you giving it a try too. Okay. All right. Good luck to you, Geraldine. Hello, Carol. Let's see. Do you have alcohol-free tinctures available? At my store, Marty Ross MD Supplements, no, I do not. I'm going to answer your question in 2 parts, though. Okay. Number one, if you are using alcohol-based tinctures and you don't want the alcohol, you could actually still use the tinctures, but you need to place the drops of them in hot water that is steaming hot water, so you can steam off the alcohol component, okay? And then those herbs are still effective, all right? So you can boil up some water like you're going to have a tea, and then you take your herb drops and you put the drops into the water and let them steam for just a little bit. All that alcohol is going to simmer off or steam off, I should say, and then you can do it that way. Okay, that's one option. Second option is some manufacturers do make glycerate versions, sugar versions of their extractions. So for instance, the reason alcohol is used in these tinctures is it's a very strong way to pull active chemicals out of the plant so that they can be delivered to you, okay? There are also glycerin extractions as well too, which is sugar. And I know, for instance, that Wildcraft Herbs does have glycerin versions of cat's claw. I would have you look at this, but I think they're Hetunia and Sida. They may or may not have glycerin versions. Where you can find out is at their website. Go to wildcraft-herbs.com and look to see if they have glycerin versions of the Sida, Hetunia, and the Teasel. I'm just not clear if they do on those. I know they do on the cat's claw, okay? And I know that she does, actually, the manufacturer of that company. And she does ship across to the U.S. She's my supplier, but she also sells directly to people as well, too. Okay. So wildcraft-herbs.com. Okay. All right. Thank you, Carol, for that question. Hello, Janice. Let's see. Hi. I was diagnosed with Lyme about 6 years ago through the Western blot and did the 4-week antibiotic protocol. After that, I started having issues with brain fog and dizziness, but I didn't really attribute it to the Lyme. Since then, I have had tingling in my limbs on occasions and now suffer with some anxiety. My brain problem is the thing that scares me the most. I don't process as well, and it's not getting better. I went to a neurologist 3 times, but they had nothing to offer. I saw your protocol for the brain. Should I start curcumin, lithium orotate, glutathione, and NT-factor? Is that a good place to start? I don't know where to turn. All right. So Janice, hold on. I just want to see something here I'm looking back at part of your symptoms. Okay. So let me make a few points, and then I'll talk about the supplement you're talking about there too. Okay. So when somebody has a Lyme infection, when we look at the success rate of that 3 or 4 week antibiotic protocol, we find that 85% of people get better and 10 to 15% of people do not, and they go on to develop chronic Lyme. And if you have a doctor that would have helped you back then, or if you had thought to go back, if you had just continued the antibiotics longer, maybe you could have gotten rid of it, okay? So one concern I have is that you may not have gotten rid of your Lyme germ adequately, and that this is still active infection, all right? Second, because treatment fails 15% of the time for the Lyme germ, all right? But these symptoms of the brain fogginess, dizziness, especially that anxiety, tingling in your limbs, could be that maybe the Lyme did get taken care of, but you might have a co-infection, another tick-borne illness that can get transmitted by ticks called Bartonella, all right? So Bartonella is known for giving psychiatric symptoms like your anxiety. Bartonella is known to cause a lot of neurologic symptoms like your brain fog and your numbness and tingling, okay? Other symptoms that that you should consider that might indicate Bartonella would be pain on the soles of your feet. Sometimes people with Bartonella have a lot of rashes that look like stretch marks in areas you shouldn't be having stretch marks, okay? Sometimes people with Bartonella will get a lot of deep abdominal pain. Bartonella sometimes will give a lot of swollen lymph nodes up here in the neck and in your lymph node areas. Bartonella can give people a feeling like they're buzzing or vibrating from the inside, even though you don't see symptoms on the outside, okay? And Bartonella can give pseudo seizures, things that look like seizures that don't officially register when a neurologist takes a look at you, all right? Now, the problem with Bartonella is that we estimate that we think there's 28 to 30 strains, of which we think 15 can infect humans. The testing is not perfect. Most labs have the ability to test for antibodies against 2 strains. All right. IGeneX has the ability to test for antibodies using a Western blot against 4 of those 15 strains. And then there is a lab in North Carolina called Galaxy Diagnostics that does a DNA test called a PCR test for Bartonella that can detect all 15 strains. However, it may miss, it may not accurately pick up everyone with a Bartonella. It can be hard sometimes to find the DNA of a germ in you, okay? So, and unfortunately, because there's difficulty determining how accurate it is to pick up or to find Bartonella, we don't know how accurate the test from Galaxy is at actually finding all cases of Bartonella when they're in a person. We just don't know. But they at least have the ability to test for 15 strains. A negative test does not exclude having Bartonella, though. That's what I'm trying to say. Okay. So I would wonder, in addition to working with things to support your nerves, if you also have to do something to treat infection that may still be bothering you, which could either be Lyme or Bartonella. Okay. All right. All right. So in terms of things that can repair nerve injury, one thing you want to do is decrease inflammation. That would be the curcumin you mentioned, and that's 500 milligrams 3 times a day. The other thing that I like to use is to repair nerves from the inside, and that would be to use glutathione. It's a very powerful antioxidant that can heal nerve injury from the inside. And that would be to use a liposomal variety that I mentioned earlier, that Trifortify product, and you want to do 1 teaspoon 1 time a day. In addition, you want to do something to rebuild the covering of your nerve membranes and also to repair the energy factories that are found in every one of our cells that can get injured, especially when you have nerve injury. Those are called mitochondria. And NT factor is one way to repair the nerve membrane. These days, I'm tending to go more with a newer product by Research Nutritionals, which is called ATP 360. It's a little easier to take and less costly. It's their newer product to repair the membranes of mitochondria. And that is 3 pills 1 time a day, as opposed to doing the NT factor, okay? Now, there is one time and one time only that I would pick NT factor over the ATP 360. And that is if I am treating somebody for the infection called Babesia, and I'm using a medicine called atovaquone, or a medicine that has atovaquone in it, which is called Malarone. If I'm using anything that has atovaquone in it, you do not want to take the ATP 360, because ATP 360 has coenzyme Q10 in it, and coenzyme Q10 can limit the ability for atovaquone to work. Okay, so that would be the only difference. If you do NT factor, then you start that at 2 pills 3 times a day. All right, so I'm going to show you some articles to take a look at here. Okay, and do a quick screen share. Okay, so this is my Lyme disease information site again. All right, so take a look at this article. Let's look at brain and nerves. All right, and you can take a look at this article called Brain Fog and Lyme Disease. You can fix it. And in here, I talk about the basic steps that you would do. And one of the things I say is make sure you don't have infection still causing this, okay? And then down here, I talk about lowering cytokines. I talk about the glutathione. I do mention the NT factor here, but these days I probably go more with the ATP 360. It's a newer product, and I need to update this article to reflect that. I don't think you necessarily need the CoQ10, and if you're not a vegetarian, I don't think you need the carnitine that I work with here, or that I mentioned here, okay? All right. In terms of Bartonella testing, and just in case you need some information about that, as I said, it's a little bit difficult. You want to look at this article called How to Diagnose, excuse me, Bartonella and Chronic Lyme Disease, okay? Janice, one more thing. So the reason I would wonder about Bartonella is something that I know. So I don't know where you live, but I know from tick studies out on the East Coast, we know that on the East Coast, that around 70% of ticks that carry Lyme carry at least one co-infection, and about 50% of ticks that carry Lyme carry two co-infections. Okay, and that's older research. It may even be higher now. All right, so co-infections are Bartonella, Babesia, something called Ehrlichia, something called Anaplasma. Those are the big Lyme co-infections. Okay, all right. Good luck to you, Janice. Hello, Jeff. Hold on here just a minute. Let's see. Hi, Dr. Ross. Are you aware of a way to determine if someone has antibiotic genetic resistance to the antibiotics that are used to treat Borrelia, Bartonella, Babesia, Ehrlichia, etc.? I've heard of genesite.com. Curious on your thoughts. Thank you. All right. So I'm not familiar with that exact site, but I'll make a few comments about genetic testing to see if you're resistant. So whenever we do genetic testing, what we're trying to see is or what we get back is we get back an idea, do you have some genetic defects, okay? Now, when you have a genetic defect, it only means that you are predisposed to have that condition. It doesn't mean you actually have that condition, okay? Because there are a number of factors that determine whether we have a problem. One is, what's our genetic programming? The second is, how do we react in our environment? What other things are we exposed to in our environment, okay? Having genetic predisposition does not necessarily mean it will manifest a problem unless there are enough other factors from your environment that allow those genes to express themselves and manifest the problem, all right? So I just want to let you be aware of that. I mean, you can do all the gene testing you want. It doesn't prove you're actually having a manifested problem that's being picked up with the genetic profile. All right? Okay. Good luck to you, Jeff. Hello, Rachel. Let's see. Roll Tide from Alabama. Well, that's an interesting opinion, and I'll just leave it at that. Okay. Let's see. I have Babesia decani, and D is decani, everyone, and Lyme, and switching to new meds. Going to start coartem with the zithromycin and pulsed tinidazole. Very sensitive and having trouble detoxing. I want to explant my breast implants this year, given the connection between Lyme, mold, and implants. Do you suggest getting implants out as soon as possible, or getting Babesia Lyme addressed first? Wow, that's tough. I would need to know a lot more. Unfortunately, I mean, it's hard to give a general opinion because I need to know how these illnesses are impacting you more than what you've said here, like what it's doing to your quality of life. How significant are these illnesses in you so that I could help make a decision on that? It would be hard for me to say in this kind of a format. Okay? All right. Good luck to you, Rachel. Hello, Tony. Thanks for info. You're welcome. About 20 years before my tick bite, I had suspected Q fever infection and had untreatable depression. I suspect I have a Bartonella, but I show no serology. So again, if you have, it's possible to have Bartonella negative testing because serology means we're measuring antibodies. And again, most labs can only detect antibodies against two strains. IGeneX with its Western blot for Bartonella can detect 4 strains. All right. So we just don't have good testing to detect all those strains. All right. All right. Good luck to you, Tony. Hello, Michael. Good morning from Australia. Good morning. I am currently treating with rifampin and azithromycin. Can add Malarone to that mix. I have tested positive for Borrelia, Babesia, and Bartonella. Thanks, Michael. All right, so the only question I have, there is an interaction, I believe, I always have to look this one up, Michael, and I'm sorry, I just don't know off the top of my head. I think that the rifampin decreases levels of malorone or of atovaquone found in malorone. Here, let's look it up together. Well, I'm going to do a quick screen share here, okay? Because I always have to look this one up. Do a screen share. All right, let's see here. Atovaquone interaction with rifampin. Okay. Okay, so basically, the atovaquone may be decreased when you are on rifampin, meaning it may not be an effective medicine for you, okay? Let me go back here. So, Michael, I think I would think twice about using malorone because it, again, it may not work because the rifampin is going to decrease the drug levels of the atovaquone part of that, all right? There are other options that you might want to look at. I have some of those listed on my Babesia article, but just stay away from the ones that have atovaquone in them. Other ones could be an option for you, okay? Let me show you my Babesia article here real quick. All right, let's see here. Oh, I keep hitting the wrong screen. Hold on a minute. There we go. All right, get rid of that. All right, so in terms of my Babesia article, take a look at this infection treatment plan section. And then look at this article called Kills Babesia, a Brief Guide. And out in here, I mentioned atovaquone. My atovaquone combinations I call Tier 1. And Tier 2, there are some other medicines you could use, an herb called artemisinin. You could use larium. The difficulty with larium, this methylquin, however, is that it sometimes can lead to psychiatric problems. You could use cryptolepis as an option. So those are some ideas for you to take a look at, okay? Good luck to you. Hello, Christina. See, does Bartonella thrive on oxygen or not? Would ozone therapy be helpful for Bartonella? So in terms of ozone therapy, I have an article about it. And you should take a look at it, but let me just tell you what I think. So ozone therapy, I know some people feel better when they get ozone. However, I don't think it is actually a good germ killer. And I think that the reason they feel better is it may help your mitochondria work better, your energy factories. So let me talk about that briefly, okay? If we were to take ozone, which is an oxidizing agent, and we were to put it on growing bacteria in a petri dish, it would kill them. All right. If we put it on growing Bartonella, it would kill them. All right. However, our blood is full of antioxidants, and those antioxidants can neutralize ozone really quickly. So there have been some test tube experiments where they've grown germs in a test tube, and they put ozone in the test tube in one part of the experiment, it will kill the germ. If they put ozone in the tube and they put a drop of blood in, suddenly there is no killing that takes place at all. That's just one drop of blood, okay? So I don't think that ozone works by killing. We do know that ozone can lead to better oxygenation of your mitochondria, giving it an oxygen burst, and that may result in people having suddenly better energy because their mitochondria suddenly are working a lot better, causing their immune cells to work better, and just helping them feel better. But I want to be clear, I don't think it is a useful germ killer for anything, whether it's Bartonella, Lyme, whatever it is. I know people use it, but if you look at the science, what the science says, it shouldn't be killing anything. And I don't think it does. I do have people that feel better with it, but I never find that their improvements are sustained. Okay? All right. Good luck to you, Christine. Oh, let me show you the article on that too. If you want to see the science, because you should make your own opinion for yourself too, take a look. Just type ozone up here. And this article called Ozone, Hydrogen Peroxide, Vitamin C, and UV blood radiation in Lyme. In here, I lay out my argument. I discuss the science. And then down here, if you want to read some of that science yourself, I actually have all the references for it down here. Okay? All right. All right. Thanks for the question. Let's see. Hello, Mary Elizabeth. Thank you so much for all you share so freely. I have severe and, of course, migrating leg pains from Lyme and probable Bartonella, nerve, bone, and muscle. The pain becomes much more horrific at night. This goes beyond the increased attention we pay to sensation at night, the mosquito and the bedroom irritation. In daylight, the pain is usually much reduced. The burning occurs solely at night. I am sure I am not the only one. Is there a reason the leg pain flares up at night? Good question. I don't know. I have not seen this occur in other patients of mine. If it would occur in a patient of mine, I would also want to make sure that the position that they're sleeping in at night is not leading to some pinching of the nerves in the back. So, for instance, if you had a small slip disc, that might put pressure on the nerves, making nerve pain worse at night. Or if you have some pinching of the nerves in the butt muscles, if you're a back sleeper, as the sciatic nerve goes down the back or the butt, you may get pressure on it as you sleep, and that could make things worse too. So one thing I would look at is there a non-Lyme and Bartonella related condition like a slipped pinching nerve in your back, slip disc or a pinched nerve in your back, or pinching of the sciatic nerve as it goes through the muscles in your buttocks area, leading to worsened problems of pain at nighttime from a position standpoint. Okay? All right. Good luck to you. Thanks for that question. Hello, Carol. Let's see. I have severe skin burning in my shins with a lesion I've had for 6 weeks. Please, can you tell me anything that may help? I recently started taking 50 milligrams of doxycycline, I think a day. I take a lot of natural supplements. I have horrible anxiety. What would help? Thank you. Boy. So burning usually means nerve injury. At a minimum, one thing I usually do for nerve injury and burning pain is I'd like to get people on glutathione to repair that injury. That's the liposomal glutathione that I mentioned earlier tonight. 1 teaspoon, 1 time a day. The product I like using is a research nutritionalist product called Trifortify. Okay. In addition, sometimes if you can help the pain by taking while you're waiting for the nerves to heal from glutathione, you can sometimes treat the pain part of it by using a supplement called L-theanine. L-theanine is an amino acid-like substance that comes from green tea. All right, and in the brain, it is converted into a chemical called GABA. Our brain and nerves have a bunch of receptors called GABA receptors, and if you give more GABA to a GABA receptor, it can decrease neurologic pain. Okay. All right. And the way you can do that, it comes as a 100 milligram pill. Excuse me just a minute here. It comes as a 100 milligram pill, and you can do I usually would start a person at 1 pill 3 times a day. and you can gradually increase up to 4 pills 3 times a day. You don't want to go over 1,200 milligrams a day, because when you get up to higher doses, there can be some linkage to cancer. All right, but 1,200 milligrams a day or lower, there is not a cancer risk as I look at the literature on that. Okay. The other thing is to treat your infection. At 50 milligrams of doxycycline seems to be a low dose. Usually we go more 100 milligrams twice a day, but that's something you should talk to your Lyme doctor about too in terms of the antibiotic dosing. Okay. All right. Good luck to you, Carol. All right. All right, everyone, that's it for me for tonight. There's a lot more questions here, but I can never get through all these. I'm sorry about the interruption with my internet being dropped here earlier. I'm glad we were able to come back. It looks like a number of you held on and still participate in the webinar. Tomorrow morning, I will get a copy of the recording out. I believe I should be able to splice and dice the second part of this webinar with the first part, giving you about an hour and a half of video tomorrow morning, but we'll see if I'm able to pull that together. If not, it will mainly be the longer version of the second part of the webinar once I was able to reconnect with you again, that will show tomorrow. Okay. All right. And then next week I have another webinar, and then I'm going to be off for a week. Okay. Or at least off the webinars for a week. And tomorrow morning, keep an eye out at your email, and you'll get something from me somewhere between 9 and 9:30 a.m. With a description of what we talked about and giving you ideas on how you can get access to the video recording. All right. Good to have been here with everyone tonight, and good luck to everyone. Have a good evening. Bye-bye.